Hello guys, welcome to my channel. In this video we are going to see about the muscles of the anterior compartment of the thigh, particularly the three vasti and also the articularis genu. If you want to know about the sartorius and the rectus femoris muscle, please do check the description box. The link is given in the description box. So let us first see about the origin of the vastus medialis muscle. So here you can see this is the vastus medialis muscle. So before going into detail about the origin of the vastus medialis muscle, we must know some important landmarks on the femur bone. So here you can see the femur bone. So here you can see the head of the femur, and this is the neck. And here you can see the greater trochanter, and this is the lesser trochanter. So this line, this is called as the intertrochanteric line. And here you can see this whole portion. This is the anterior surface of the shaft of the femur. And now coming to its posterior view. So as I already said, you can see here, this is the greater trochanter and this is the lesser trochanter. And here you can see the tip of the greater trochanter, and this is the neck. And here you can see a crest. This is called as the intertrochanteric crest because it lies in between the greater trochanter and the lesser trochanter. Then here you can see the spiral line. So this is the spiral line. And this portion is somewhat rougher, and this is called as the gluteal tuberosity, where the gluteal muscles get attached to. So here you can see a line extending. So this is the medial lip of linea aspera. And this is the lateral lip of the linea aspera. So these are all the important landmarks that we must know in femur to know about the origin and insertion of the vastae muscles. Now coming back to the origin of the vastus medialis muscle. So this muscle gets its origin from the lower portion of the intertrochanteric line. So this is the distal part of the intertrochanteric line. So from there it gets its origin, and so it also gets its origin from the spiral line and also from the medial lip of the linea aspera and also from the upper 1/4 of the medial supracondylar line. So this medial lip of the linea aspera continues as the medial supracondylar line. So this muscle also gets its origin from the upper 1/4 of the medial supracondylar line. So coming to its insertion, it gets inserted into the medial border of the patella and also into the articular capsule of the knee joint. Then coming to its nerve supply, as I already said, all the muscles of the anterior compartment of the thigh, they are supplied by the femoral nerve. So the nerve supply for the vastus medialis is the femoral nerve, and it has the root value L2 to L4. Coming to its action. So the main action of the vastus medialis is locking of the knee joint. Whereas the unlocking is done by the popliteus muscle. Then the another action is the extension of the knee joint. So the next muscle what we are going to see is the vastus intermedius. So coming to its origin, it takes its origin from the anterior and lateral surfaces of the shaft of the femur. So here you can see mostly it takes its origin from the anterior surface and also from the lateral surface of the shaft of the femur. So coming to its insertion, it gets inserted into the base of the patella. And also another thing, this vastus intermedius lies beneath the rectus femoris muscle, as I already mentioned in the previous video. So here you can see this is the rectus femoris muscle. I am just hiding it in order to show the vastus intermedius muscle. So here you can see the vastus intermedius muscle. So then coming to its nerve supply, it is also supplied by the femoral nerve. Having root value L2 to L4. So coming to its action, it also aids in the extension of the knee joint. Its main action is to extend the knee joint. Then coming to the next muscle, vastus lateralis. So here you can see this is the vastus lateralis muscle. So now coming to the origin of the vastus lateralis muscle, it takes its origin from the upper part of the intertrochanteric line and also from the anterior border and also the inferior border of the greater trochanter. It also takes its origin from the lateral lip of the gluteal tuberosity. This rougher portion, this is called as the gluteal tuberosity, where the gluteal muscles get attached to. Right, so it also gets its origin from the lateral lip of the gluteal tuberosity. Then also from the upper half of the lateral lip of the linea aspera. That's all about the origin of the vastus lateralis. So now coming to the insertion of the vastus lateralis muscle, it gets inserted into the lateral border of the base of the patella as well as into the upper 1/3 of the lateral border of the patella. Then coming to the nerve supply, as I already said, all the muscles of the anterior compartment of the thigh, it is supplied by the femoral nerve, having root value L2 to L4. So coming to its action, as like the other two vasti muscle, this muscle also helps in the extension of the knee joint. So there is another smaller muscle in the anterior compartment of the thigh. So that is the articularis genu muscle. So here you can see this is the articularis genu muscle. Coming to its origin, it takes its origin from the anterior surface of the shaft of the femur. Here you can see it takes its origin from the anterior surface of the shaft of the femur and it gets inserted into the suprapatellar bursa and also into the synovial membrane of the knee joint. So this is the origin and insertion of the articularis genu muscle. As like all muscles of the anterior compartment of the thigh, this muscle is also supplied by the femoral nerve, having root value L2 to L4. So coming to its action, this muscle helps in the pulling of synovial membrane upwards during the extension of the knee joint in order to prevent the damage to the synovial membrane.